Hello, hello, and welcome. Let me know in the comments where you all are watching from. I would love to know, okay? And also let me know if you can hear me, okay, in the comments. I want to make sure that you all can hear me. All right, so I have a very special show for you tonight. Welcome everyone. Let me know again if you can hear me. But I want to let you know, welcome to those who are joining live, and hello to those who are watching on the replay. Make sure you like and subscribe. Okay. Now, many of you have asked me if I was a medical tourism facilitator, and I am not. But if I cannot speak to or answer your requests related to medical tourism, I am committed to finding individuals that can. So I've searched and searched for medical tourism facilitators, specific ones that look like myself, because I am committed to educating and informing Black women about all aspects of medical tourism if they decide to seek care or treatment abroad. So if you are new to my channel, welcome. I'm Dr. Natasha Ramatal, also known as the Medical Tourism RN. Today, we're going to discuss the role of medical tourism facilitators and what you need to know before you go. Now, I know there are two perspectives in this audience because many of you have written me about this topic, and some of you would like to know more about what a medical tourism facilitator is and what they do and how they work and how to vet one. And the others are interested in learning about how you become a medical tourism facilitator. So today's discussion will help you uncover how these behind the scenes experts take the stress out of healthcare travel, ensuring that you get safe, affordable, and high quality treatments across the globe. And in many cases, a good facilitator can make all the difference in your medical journey if you decide to engage in medical tourism. So I am going to go ahead and bring on our special guests and have them introduce themselves. Good evening, Shana. Thank you for joining. Thank you for joining. Let me know if you can hear me well. All right. Hello, special guests. Welcome, welcome.
Hello. Thanks for having
Welcome.
us.
Thank
Yeah,
you both. Thank you both. I want to go ahead and have you introduce yourselves, and then we can get started with our discussion. I will start with Shirley. You're actually next to me. So, Shirley, do you mind introducing yourself?
Not at all. So I'm Shirley Whitfield, and I am CEO and founder of Surge Med Spa Transformations. It is a medical tourism outfit, and we have been doing this for quite a few years now. Um, Unfortunately, we've been doing it more informally at first, and over the past year, we've decided to really dig deeper because we found that it was quite a need. Um, our medical tourism is a little bit different from uh, those that you may find around the world because we start in the US and we can help people find procedures within the United States or help them to go abroad to find procedures. So we sometimes partner with medical tourism companies that are um, specialized within a specific country or a specific procedure. We focus on elective surgeries for the most part. So I will say butt lifts, breast lifts, hair transplants, tummy tucks, that sort of thing. But we have had quite a few inquiries on more complex procedures, like what you hear from Giselle. We also mix our services with wellness. So you will find in my conversation, I will talk to you about medical procedures and travel and how we get there, but I'll also mix it in with how can we ensure that you have a wellness experience before the procedure and after. So should I stop there?
Yes, let's
Okay.
stop there.
And
We
then
don't
I
want to
go
give
to
them too
Giselle?
much right away.
Very good.
I will have Giselle. Go ahead and please introduce yourself, Giselle.
good evening, everyone. My name is Giselle Mettam, and I am the Executive Director and co-founder at Metta Health Medical Concierge. So we're based in the UK, and we support people who are frustrated and fed up with their current healthcare to access and navigate private healthcare in the UK. So we are connected to a network of over 1,000 physicians and surgeons, perhaps even more. So we can cater for a variety of health conditions. So whatever your whatever health condition is causing you stress or pain or discomfort, we can find a world-leading UK healthcare consultant to support you to resolve that issue as far as possible. So we take care of, so we find the right person, and we're very, very careful about the way that we match the consultant with the patient, very much like dating. So it's got to be, we're very unique in the way that we do that. Um, and then we also arrange transport. So you get picked up at the airport, taken to the accommodation, which we arrange based on your needs and your preferences. We make all of the medical appointments so that there's no stress and burden to do that, to liaise with the consultant and the admin team. And we also look after aftercare. So, because we know that recovery is just as important as the surgery. If we don't have safe recovery, then that could really undermine the fantastic benefits that you get from surgery. So we look after your aftercare and also follow-up. So things like wound checks and dressing checks, making sure that those are done in good time. And then for the people who travel to the UK, we make sure that they're seen before they go back home, wherever they're from. And then even once they're in their own country, we contact them, follow them up to make sure that they've had a safe journey home. And if there are any issues, which there seldom are, um, then we will follow that up, liaise with the consultant, and even if there needs to be a discussion between the consultant in the UK with the consultant back, where from wherever that client is, then we can arrange that. And our USP really is the fact that we really do match the clients carefully to get the best outcome, and also we tend to work with surgeons and physicians that are committed to minimally invasive procedures. So that means less pain, less trauma, and a faster recovery.
Oh, thank you for that. And so, guys, I just want you to know that both Shirley and Giselle's contact information is listed under their names or next to their names, so that you can go to their websites and access all the information. But I want to get started. And I think the first place to start is a lot of times because I share information specifically on Black women, and they're educating them on what they should know before they go if they decide to engage in medical tourism. They think that I am a medical tourism facilitator, which I am not. I know a lot about it. One of the things I wanted to ask you about, because I do have knowledge about the differences between medical tourism facilitators and medical tourism concierges. And I know a lot of it overlaps in terms of what you do. But if you don't mind sharing the differences, I know, Shirley, you would probably be under the category of medical tourism facilitator, correct?
Well, I've heard the term used interchangeably, so
Mm.
originally I would have thought so, but more recently I'm starting to realize that there seemed to be a consensus that concierge is a person who does the consultation with the individual, finds reputable providers, matches them to the just right country and procedure, but doesn't actually accompany the individual abroad. Whereas a facilitator, would do all of that a concierge has done, as well as track with them in the country and make sure, and maybe even intervene if there's a crisis, or if the patient is vulnerable for some reason. So there, from my perspective, I'm learning more that a concierge is the meat and potatoes in the beginning, but the facilitator goes even beyond that.
And Giselle, give me your perspective, because I would think that you were concierge services. Can you share your experience?
So as a medical, like Shirley said, the terms are used interchangeably, and in fact we do the same thing. From the UK, It may be slightly different in the US, but in the UK, we look after the patient from the start of their journey to the completion. And one of the key factors of that, besides making all the arrangements, so handling all the healthcare logistics, the things that, when people are vulnerable, would cause them stress, like having to make those appointments, and for diagnostics, for the all the appointments that they have to make, even making appointments for their procedures, their aftercare, because once someone's had the surgery, if they need aftercare, arranging nursing or arranging just for someone to pop in and see how they are, making sure that they get their wound checks, all those things that are really to a safe journey. So from a medical concierge perspective, based in the UK, we absolutely do everything from end to end. And finding the right consultant is a really important aspect of that journey, because if you find the right person, you get the best outcome.
Right.
If you find the wrong person, then that person is going to have a serious impact on your life. And we see examples of that quite often when people go abroad. For instance, I'm not going to name any countries, but they may come back with some serious complications that has to be put right in their home country. And so as part of the medical concierge service, we manage risk. And that's a critical part of any healthcare journey, but particularly if someone's traveling to another country for healthcare.
Okay. Let me ask you, Giselle, do you handle cases outside of the UK? I know you have international clients coming in and you handle the UK, but do you manage others in going to other countries?
We don't.
Okay.
And so we only do inbound medical tourism.
Okay. The reason I asked that is because my understanding of a medical tourism concierge was they do the same thing as medical tourism facilitators, the pre, the post, handling even documents, travel logistics, local accommodation, transportation, meals, medications. However, the difference I was told was that a concierge usually is inbound and located in one country or region, and they may specialize in that, or they may even specialize in a specialty and only take cases in that one location for those types of cases. Whereas a medical tourism facilitator, I was told, was a bit more broad, and they handle, which I know they can still specialize, but they handle global, international patients, of course, but many different sites. And that's because they may have a network that they're tapped into where they connect and vet in a number of different countries. That was my understanding of it. And I know some stop simply at connecting them medically, and then some go beyond and do the full service, is what I was told by some.
Fair enough. We can use that as our working definition.
All right, no, that sounds good. I'm glad to hear that. I love that you mentioned the dating part in terms of how to vet, because it's true. Not only when you're seeking specific healthcare, but even to find one of you guys to help someone like myself or anyone that's even watching find the right care. And I think we're going to delve into that. I think what we can talk about first is I would really love to hear a little bit more about your journeys to becoming a medical tourism facilitator, because you both have very different backgrounds. And I think someone hearing anything with the term medical in it will make an assumption that you must have a clinical background. And that's not necessarily true when you're talking about medical tourism facilitators. So this time I'm going to start with you, Giselle. Can you kind of share your background, your training, and what led you to becoming a medical tourism concierge service facilitator?
Certainly. I do want to kind of clarify that medical concierges can work across the globe.
Oh, okay.
There
Great.
are that would work across the globe. And actually, we get a number of inquiries about that. The difference between us is that we choose not to do outbound medical tourism. And the reason for that is because we can vouch for the quality of care in the UK.
Okay.
We can't vouch for the quality of care in any other country because we haven't worked within that country. So what we would want for ourselves is to have care in the UK where we know that there's a high standard of care.
So, thank
So
you for making the distinction. No,
think
that's
I think,
important.
Giselle, we should also let the audience know that you and I have been talking about working together, and so that is the perfect way to do something like this. If you are going for a complicated surgery and you're looking for the right place to do that, you know, selecting the UK, a developed country with restrictions um, on patient data and health, um, you know, abound, is a nice way to do that. You could contact Giselle directly, or you could contact me, and I will, you know, sort of get you situated on the U.S. side. Will help you with financial um, options to fund your endeavor, and then and help you with a plan. And then Giselle and I will move you from here in the U.S. I'll handle your travel arrangements, get you into the UK. Giselle will make sure that, as she mentioned before, that you have your virtual consultations and your accommodations are set up before your procedure and your aftercare, and then I will ambulance you back to the airport, through the airport, onto the plane, VIP medical service in the airport, making sure you get back home, and then making sure you have nursing aftercare even at home. And, you know, perhaps even for a year after that, maybe some med spa care to, you know, just sustain whatever the surgery is and make sure that your therapy is on point. So, you know, we do this as a job, but you as the patient is, you know, that's our goal. We need to make sure that we make sure that that patient has everything she needs or he needs from beginning to end and beyond.
Yeah,
yes,
no, I think it's important.
yes, absolutely. Thank you for that, Shirley. That really it was an excellent synopsis of how we'd be working together. Now,
Yeah.
to answer your question about how I arrived at this point. So my background is I am a nurse. I'm a cardiac nurse by background, and I've worked in healthcare for most of my career. Um, and in terms of my experience, I've done frontline nursing. I've done within healthcare project management, research, program management, service transformation, system transformation, and worked at a senior operational level to board of director level. So I was in charge of hospitals, in charge of very large teams, and was responsible for all the healthcare transactions in the hospital as a director of operations on the board and reporting to the board on all the activity in the hospital, including the emergency room, and things like cancer care and diagnostic care, elective care. So I've done my 18-hour days in the I've got
I'm
all
a
the
nurse, so my background is emergency department. So it's really interesting. What led you to medical tourism?
yes. So that's really interesting. So I kind of got to the point where I thought, if I continue on this trajectory, I am not going to make it. um, and
Burnout.
you probably had glimpses of that when you were doing your ER nursing. Um, and I thought, I have to change something in my life in order to preserve my life,
Right.
to preserve my health. So healthcare is my first love. It always has been. Looking after people, making sure that they get the best care possible has always been my passion. And so I didn't want to work outside of the healthcare arena. I wanted to do something different. Now, what happened to me was this. My dad, who lived in another country, needed a spinal operation, and a spine operation is it's a major operation. It's a serious operation by anyone's standards. And I remember thinking, I don't want just anyone to touch my dad, because it's my dad, right? And I'm a
Mhm.
daddy's girl, and um, I thought, I have to get the right person. I have to do this. So I was really busy at the time, but I spent time researching and finding the best neurosurgeon to work on my dad. I thought, he's got to do it minimally invasively. It's got to have a really good reputation and clearly the best outcomes possible. So I did the research, and to kind of cut the story down, everything I worked out: consultation, when he was going to have the operation, how he was going to be looked after, which was why I took the time off to do that. So I mapped out his whole journey with this consultant. My dad came to the UK, had the surgery, and I remember the surgeon explaining that he would be in the intensive care unit when he came out of surgery. And you will know as a nurse that when you hear those words, intensive care, you have this vision of that person looking as if they're in a coma with tubes coming out and looking quite seriously unwell and not moving, which is how I wanted to see my dad necessarily. But that was the process. And I remember waiting whilst he was having the surgery with my brothers. And we were waiting in this waiting area very, very anxiously. And the surgeon came out, as they do, just like on the movies, taking off his mask and whatnot. And he came up to us and he said, the surgery's finished. It went really well. Now, when a surgeon says that, what do they mean? They mean it went well from their perspective. That isn't telling you what state your relative is in necessarily. You would know that as a nurse. So I remember walking down the corridor towards the ITU unit, the intensive care unit, with my brothers, and my legs wouldn't take me. They weren't listening to what I needed them to do. They just were like jelly. So I remember shaking. I was walking down, and then there was this big door, and I tried to push it, and I couldn't push it, so my brother had to do it because I didn't have the strength. And as I walked in to the intensive care unit, my father was the first patient. And I looked at him, and there he was sitting up having a salmon dinner with a little plaster on his neck, looking as if he'd had the best facial in the world. And he said, "Hello, come in." And I remember thinking, I just want to burst out. I just wanted to burst out in tears because of the relief of seeing my dad like that. And I didn't, because I had to be strong for everyone as the nurse in the family. So I went over to him and I was just so amazed. And he said, "Oh, 20 minutes. I have to have my first physiotherapy session now." He'd just come out of surgery. And I was just aghast. So when we left the ITU, I remember bursting into tears because I could just kind of let it go. And he recovered. He was discharged after 3 days. And then 10 days later, I took him to a concert at the O2 Arena.
Wow.
And,
That's amazing.
right? And I remember thinking as I was walking out from the ITU, I want other daughters to experience that. I want other sons and mothers and husbands and wives and uncles and nieces and nephews. I want other people to experience the fact that everything went in the way that it did, and the fact that they didn't have to open my dad, because this surgeon was really focused on minimally invasive procedures. They didn't have to cut my dad open, that, there was a little plaster on his neck after having spinal surgery. And that's where the idea of Metta was born.
That's interesting. Wow. Wow. Such a touching story. That is amazing. I mean, making that switch off of that one experience alone, with your number of years in a number of different roles within healthcare, leading you to medical tourism. But honestly, it's a move that's made from the heart. So I think that actually adds to just your commitment to doing this type of work. So wow. And Shirley, I would love to hear about your background because it is different from Giselle's, and I would love to hear, yes, what led you to your background, but then also what led you to medical tourism. And then we can get in some of the meat of how to find you guys if someone wanted to reach out and obtain your services.
Okay, so I do not have a clinical background. However, I have just retired as a pharmaceutical executive, surrounded by many doctors in 15 therapy areas and disease states that I've learned and trained representatives on over the years. So I do feel like I have a good grasp of the human body and the United States healthcare, and I'm slowly wrapping my head around the rest of the world's healthcare. It's 72 different, healthcare systems. Um, it all started at Howard University.
Ain't
I,
you?
yeah,
McGrath.
and at Howard, we learn, if nothing else, we learn grit. We learn how to get it done. We learn how to rise to the top. We're the cream of the crop. And I came out of there and I went into Wall Street and learned all I could about financial instruments, financial math, and financial economics, and stayed there for quite a while, doing a lot with private banking and private wealth management. Did some financial systems management as well. From there, I moved into entrepreneurial space where I owned spas. I had a cosmetology background before Howard, and owning spas is very different. I mean, you the laws, on around spa or just touching the body in general or the face is, they're intricate and they vary from state to state. And I had spas in Delaware and Pennsylvania and in Florida. And so my clientele was vast. And not only did I have uh, what you would probably think would be, when you think spa, you think a middle-aged woman, but I had children in this as spa members as well, and I ended up selling that to Nickelodeon. From there, I went into uh, the pharmaceutical space, and after retiring from there, I decided, my passion is beauty, women in particular, Black women, traveling, and I got to find a way to keep these people safe
Mhm.
because we're harming ourselves. And I can go into that a little further and how I see that happening in many different ways. But I think advocacy and consultancy goes a long way.
Mhm.
And I've been to 40 something countries. I've launched 300 global medicines around the world. I've done a lot with finances and funding. It's time to put it to use and, really share it with the world.
Oh, that's beautiful. Because I was telling the audience, you guys, you do not have to have a clinical background to engage in medical tourism facilitation. Certainly, it helps. You're knowledgeable of specific procedures and those types of things. But listening to Shirley with her business background, extensive finance, accounting, and then entrepreneurial spirit, I think having maybe the characteristics is important in terms of being detail oriented, someone who's able to be flexible, someone who is knowledgeable or willing to be trainable, so that you learn about the various global systems or health systems, depending on where you plan on going or you would like to go. All of those things. And we're going to get into that. I think now we can kind of talk about what would someone need to do if they were to seek out either of your services? Why should they seek out your services? I'm always talking about educating Black women in particular so that they have improved outcomes, health outcomes, as well as a really great experience if they're going to engage in medical tourism. So I would love to hear from both of you about why someone should engage in having someone like you be their advocate versus maybe going at it alone. And either of you can start.
Shirley, please.
Well, I I may not say what you want me to say, Dr. Ramontel. Like
Right. Hey, no
I've
holds
I've been
barred.
known for that. because being that I have a business background, the reality is people are going to do what they want to do, and they'll take risks that are unattainable in my perspective. But and so what I've tried to do is say, look, if you really want to do this well, and to Giselle's point, you want to have a successful event with no issues, then let me help you.
Right.
It may be an additional cost, but you won't miss it. You'll thank me later, kind of thing. And so I have that service for people, but I also have the service for, you know, the people who feel like, I can do this. I'll get on Expedia, I'll grab a bus, I'll go to Mexico, like whatever the mind and spirit of adventure takes them. I've seen people say that they want to do it themselves,
Mm-hmm.
and I look at that as, okay, you are a medical tour concierge in the making. And so let me help you as well. Not so much with consultancy, but I have a training program, and you can get it
Mm-hmm.
on the website at medspacruise.com,
Okay.
where, in the space of about 3 weeks, and we do some group class work virtually, and there are a couple of sessions with just myself, where we help you plan your your personal medical tourism plan. So you use yourself as the person that we're going to help, and we help you get there, as a group, instead of using my personal consultancy. You have this like group experience, and so sometimes that's just as good for people.
Mm-hmm.
Um, and I find that those folks, after having their surgeries or procedures, they tend to come back and say, "Let me help others." And so I now have them as a part of my team. But
Wow.
there are two different perspectives on how to do this thing. And my personal thought is go with the professional help. But if you really want to do it yourself, then let's help you with the training program.
And I actually put medspacruise.com, which is Shirley's
Oh,
website,
nice.
in the chat for those of you interested. I didn't realize that you also trained people to become a consultant. So that's really interesting. And Giselle, I
It's
would love to
it's
hear you
it's
answer that. Oh, go ahead.
startup training. I
Start.
wouldn't. It takes a
It's a
it
start.
takes a lot to actually become, because you want to be a certified travel advisor. Like it's a whole thing to get these certifications. But the startup, I'll give you the basics. You'll get a plan in place, and you won't go in blind. So
No,
that's it.
that's really helpful because a lot of individuals have expressed an interest in it. So I think that's a good starting point.
Oh,
Yeah.
I do
And
too.
Giselle, share, please do share. I know you cover the UK market specifically, but share any information on why someone should go with someone like yourself rather than trying to go at it alone.
Well, I think there's several reasons why people would want to travel abroad for healthcare. Um, so I'll start with this. Like Shirley was saying, you I would say to people, if you do want to go it alone, you think you can, Google things and get things organized. I understand that people are trying to cut costs. Um, what I will say is that any healthcare journey carries inherent risk.
Mm-hmm.
And sometimes we can underestimate how vulnerable we can feel when we're going through a healthcare journey until we're actually in the middle of it
Right.
and there's a problem and you need that support and the support isn't there.
Mm-hmm.
That can really undermine your efforts. So you might start off saying, right, I can do this. I'm really strong. I can do this. But if you want to manage risk successfully, then it's always good to have someone who can support you to do that.
Right.
Um, and so, why would they want to come to the UK? I'll start with that. Well, we know that the healthcare costs in the US are escalating.
Absolutely.
And that there's not only the obvious cost, but there's the hidden cost. And there's this issue about medical debt and the fact that if you embark on a healthcare journey within the US, you know, this could happen. I know that Shirley, for instance, would have lots of financial advice and perhaps how to mitigate some of that, but it's still significant. And I'll give you some examples later on when we go into the examples of difference in price, for instance, between the UK and the US. So that's one of the reasons, that's a big reason why people travel. The quality of care, it may be that what you need is too expensive, too far. And so, excuse me, you're looking at options. And, you know, people might think, okay, well, I'll go to a really cheap country. What I will say is don't do that, please, because your healthcare is the most important thing that you possess. Without your health, you know, the money that you would save going to, you know, doing it really cheaply is not a saving because it's your health.
Right.
And what I would say is in the UK, the quality of the healthcare is really high. It's really well regulated. I'm not saying that it's perfect because no healthcare system is perfect, but we have state-of-the-art private hospitals. Our consultants, they have to be qualified. So we only work with consultants that have a National Healthcare Service contract, which means that they are very well governed. The care that they deliver is very well governed. And so the risk is mitigated because of that governance. The healthcare in the UK isn't as expensive as people say it is, or think it is, you know, if they haven't like researched it thoroughly. The healthcare in the UK is actually it's actually quite reasonably priced. And once you've seen a consultant, you are given a price, and that's the price of your package. The only way that would change, that added, is if something untoward happened that wasn't expected. The other thing I would say is that, you know, for us, we are obsessed with minimally invasive procedures, and that's a really important aspect of healthcare.
It is.
Because, you know, if you're having a tiny cut with less bleeding, less trauma, no drain needed, so they recover quite quickly, and relatively painlessly, then you can enjoy London and enjoy Europe, you know, if that's what you want to do, and you can get back to work very quickly. I'll give you an example. Cataract surgery, and we'll go on to the hips and the hearts and whatnot hopefully later, but just a simple example, cataract surgery. We work with one of the best hospitals in the world, and so they train consultants from all over the world. And for our cataract surgery, we work with them. They undertake cataract surgery. It's 10 minutes per eye.
Wow.
If that. The procedure is completely painless. Just a little bit of redness afterwards. And within a week, you know, people are feeling back to normal again.
That's amazing. That is amazing. I want you to pay attention to what Giselle just shared, because top reasons, obviously, people look elsewhere in terms of medical tourism. Cost, obviously, but it should not be your single factor, right? Because if it's too good to be true, it probably is. And you may not have the quality to back it up just because it's a much lower price than the US, which you can find that in a number of different places, obviously. But cost, access, and availability, but also think about how invasive you may encounter depending on where you go. You do have to think about that, because that factors into your downtime. It factors into your travel time. You have to think about, what if I happen to have some type of issue occur even after that. That adds to all of your things that you have to take into account when you're thinking about going for treatment or some type of surgery. So thinking about minimally invasive procedures as well, the innovation that is used for whatever surgery or treatment you're going for, you do need to take that into consideration as well. If it costs a little bit more to maybe go to the UK versus another country, think about all of the factors such as minimally invasive, the quality of care, the credentials and the vetting and the accreditation that comes behind that. Make sure you're looking at those details as well. I really love that you brought that up.
Yeah,
You know?
it's good. And you've raised a really you've emphasized a really important point. It's always, when things go well, that's brilliant. Healthcare isn't like that. As I said, there's inherent risk in any procedure that you have. There's risk in taking a tablet. You know, if you look at all the side effects of a simple medication, Shirley would know that, you probably wouldn't take it. You know, there's there's risk in everything.
I can
So
say that now.
right. So it's really important when you're planning to understand and identify what the risks are, and be clear about how you're going to mitigate those risks. And one of the risks is, what if something goes wrong? What if someone has a cardiac arrest on the table? What if, you know, so when you're being consented for an operation, you would know that they list all the things that could happen, and you're signing that form. When you put your signature on that form, what you're saying is that you understand that there could be several different complications, including death. I'm just being real here.
Yeah, no, you should.
When you sign the form, you're saying that you're okay with that. You're saying that you understand the risks and that you're okay with those risks. If there isn't a clear plan about what happens in the event that those risks occur, then you shouldn't be doing that journey, is what I would say. If you ask someone, so this is my advice to people who are going abroad, always ask, please emphasize what the risks are and what the plan would be if those happen. If they can't answer those questions, and it doesn't matter what procedure you're having, if you're having a piece of hair take, you know, a wig, whatever it is, if you're traveling abroad and you're going to a different country, there's a cultural difference immediately. And so ask the question. My advice would be, ask the question, what are the risks and what is the mitigation? What is the plan? If they can't answer the question clearly and your satisfaction, please don't go, because you're putting your health and your life at risk. And you have to ask yourself, is it really worth it? And so the benefit of having someone who will support you is that we focus on managing that risk. So I know, for instance, in the UK, if something were to happen to someone, if there was a complication on the table, or so on the table, there would be emergency procedures in place for them to deal with that. If the person left the hospital, was discharged, and then a complication occurred as a result of the surgery, well, because of the governance procedures within the UK in term for private and public hospitals, something has to be done about that. And if it happens within 30 days of discharge, then they have to correct it.
Wow.
And okay, so all these details, particularly about emergency protocols, you should know before you step on that plane to put into healthcare professionals in another country.
That's very interesting that you brought up that point, specifically about the UK and the emergency procedures and post, if they encounter any issues, that the surgeon would have to fix them. Because I rarely hear of anyone going for medical tourism going for surgery through the use of medical tourism and staying anywhere, even for that amount of time. They're hopping on a plane a couple days later, even if it wasn't suggested. They're still doing that. They're turning around and I have to get back home. I have to get back to work, whatever the case, and not necessarily even taking physician's orders to sort of stick around. And it ties also into some of these people are getting on the planes with trains. I've seen that. And it's interesting that you talked about the minimally invasive procedures where someone could actually have a good time and experience the tourism aspect of medical tourism. So that's really interesting. So I think that it's important to note that, because people go off of what they hear. And a lot of times, unfortunately, it may be social media. Whether it's true or not, they're seeing one part of the journey and
Yeah.
they assume that their journey is going to be very similar or exactly the same. And that's not always the case. That's not
No.
always the case. We have a comment here. Authentic Life says, it's nice to learn about the quality of care in the UK. Sadly, we in the US don't always hear about healthcare in other countries, or at least hear anything positive about them. You are so right, Authentic Life. I mean, we are actually brainwashed, I have to say that, in the US to believe that everywhere else is inferior in terms of healthcare. And what we hear from a number of folks that either move, whether they're expats, repats, or even people who are just from other countries, when they come here, it really is shocking to them. Not only the cost I think is everyone is aware of the high cost here, but they wonder why. And they get a fraction of what they would in their own country in terms of the time that's spent with them, with a physician. You know, I have a number of people in the Exodus Summit community that I communicate with, and they all, you know, some are in Mexico, some are in Costa Rica, and different parts of the world, Thailand. And they say, you know, my physician gave me their cell number. Where do you see that? They contacted me, or they did a home visit, or they called me after, they stayed with me, all of those things. And it was nothing extra. That is unheard of in the US. I will tell you, that's unheard of. So to hear that type of thing is interesting, much less if you're thinking about something very serious like a surgery, whether it's cardiac, cancer related, whatever it may be. Those are the kinds of things that people need to take into account, you know. So really important.
I think on top of that, the US, navigating the US healthcare system is extremely difficult. I think
Yes.
a lot of people get frustrated from the very start. They may desire a procedure. They may even be told by their physician that a procedure is needed. But
Mm-hmm.
then once they realize, well, wait, I have to go through a specialist, and then I have to go through an IDN, and I have to get approvals from insurance companies, and HSA may or may not be used. And I mean, they just kind of sit it out, or they try to go overseas for something that seems a little easier to navigate.
Yeah.
So I think you're absolutely right in that access and availability is it's a driving motivator to go overseas. I think in addition to that, what I find when I sit down and do a personal plan is that my clients do want me to consider cost, but typically quality or time seems to be what they focus on, after they get past sort of the cost conversation.
Okay.
And I help them to, think about, how can you get what you want? Like I was saying to you earlier, Doctor, rarely does someone just come up with the notion, I want to have a procedure and then
Mhm.
next week they get it done. Rarely does that happen. Typically they think about, they come up with that desire, they do a little research, they talk to people, they think about it, and it sometimes can take months to years before they actually have procedures done. And
Right.
so I help them with, a plan over that 2-year period of time. What can you do to optimize your funds so that you get what you want?
Right. It's interesting because what I found was what even led me to even creating this channel was when I was in the emergency department in Miami, a very large hospital. many people were going abroad for elective surgeries, predominantly Brazilian butt
BBL.
lifts, breast surgeries, gastro issue, all kinds of things, weight
Fillings.
loss surgeries. And oftentimes they flew back within a few days back home, and they experienced complications, very serious complications. And the US is a very litigious society, and you find that physicians do, and this is global, no physician likes to work on what another physician worked on. They say they started it, they should finish it, and they should follow up with that one, because the stitching is different. It could be the same procedure, but done differently. To Giselle's point of minimally invasive versus opening you up. Right. And
Yeah.
so I had to care for a number of individuals, predominantly Latina and also Black women, and they had no clue things were done incorrectly. They had no one to advocate because they were only looking at the end result. I want X look, and my insurance isn't going to cover it. They save up a sum of money. They usually it's word of mouth. They heard something or they saw something on social media and made the assumption that it was going to be the same process and same outcome for them. And they're sadly mistaken. And unfortunately, they end up with a number of complications that lead to a whole road full of continuous visits for something they had no idea would happen along their plan of care. So I think it's important for someone to know exactly what the steps are when they're going to be working with someone like you both. Like, walk me through when someone says, okay, I'm looking to have X procedure. What do you do first? Do you kind of look into a procedure and a location? If they have an interest in a particular location, what would they do with you all? And it may be different, and I'm sure there's some overlap, but I'd love to hear how you walking through that process a bit. What
So,
to expect.
Shirley, would you like to go first, or should I?
No, go ahead, Giselle.
Okay. Yeah. So, if someone was considering having a procedure in the UK, we would have a conversation with them, and we would have an in-depth initial assessment to understand what the issue is, and understand what's happened so far. You know, their pain levels, their discomfort levels, how it's impacting on their life, their lifestyle. Are they sporty? Are they sedentary? Are they, so their lifestyle, and what's worked, if they've had treatment before, what hasn't worked. And what's really critical for us is understanding what outcome they're looking for. Fast forward a month or so from now, how would you know that this has been a successful journey for you? Because we want to get that vision right.
Right.
It's not always accurate. In terms of, some people might think, oh, if I do X, I will get Y. And so that discussion and managing expectation is really important. If they want to, after the conversation, if they're thinking, yes, we definitely want to proceed, a really important step is getting the diagnostics, the imaging, and the last doctor's letter, so that we can see from a clinical perspective what the status quo is in terms of their health. And then what we would do is a kind of go out to our network. We've got a vast network of world leading clinicians. So we'd go out to our network and we'd look and see who would deliver the best outcome for that particular patient. And this is really important because, we have a number of surgeons. You have a number of orthopedic surgeons, gynecologists, or, cancer doctors. So we've got quite a wide choice. But say, for instance, for you, Natasha, if you wanted hip surgery, for instance, the hip surgeon that I choose for you may not be the same as someone who is sporty and wants to get back to playing quite hard sports. And it may not be the same hip surgeon that we would choose for your mum or dad or relative. Do you see? So there's a difference. And so we make sure based on their lifestyle, their age, and that kind of holistic view, that they get the right surgeon for them, because we want them to have the best outcome possible, just like we would for ourselves.
Right.
And then once that process is, we refine that process, we would say, okay, so we found maybe 2 or 3, maybe one that we think this is the right person for you. This is a person that we recommend. And we would say to them, please do the research to make sure that you're happy with that person.
Okay.
If you're not for any reason, then we're happy to find someone else. But it's really important that they know who the surgeon is or who the doctor is, and that they're happy with that person. Once they want to proceed, we would then arrange a virtual consultation, or if they want to come over to the UK, because that's what they want to do, we would arrange a face-to-face consultation. And then based on that consultation, they get acquainted with the consultant, they build a rapport, the consultant does that assessment of them, and they will perhaps recommend a course of treatment. We can then give them the approximate price before they leave their country, because we don't like surprise. It's a very important aspect of medical travel, understanding what the possible costs are, so that you can plan for that, and that you don't get surprises.
Right. Can we pause right there? When you say you give them recommendations after you've searched through your pool, are you giving them more than one recommendation, or one that you believe is best for them? And then if they happen to research and say, no, I'd like to go with someone else, then you offer them others that you've vetted?
It depends on the condition. Sometimes we can do 2 or 3, or sometimes say we recommend this person for this reason, but please do your research, and once you're happy, we can proceed.
Okay.
And that's, it's a very friendly process in that respect, because we want them to be happy. And then once they've had their virtual consultation, we kind of price up the package. There'll always be an estimate, because in healthcare things happen and there may be something additional, but we have a really good sense of what the cost will be, including our medical concierge fee. So you've got the fee for the treatment, the medical concierge fee, and then accommodation and whatnot. So we can give them a package cost.
With that package cost, if there are, say, common issues, do you have a pricing level? If this were to occur, it would range in this amount. I know there's not exact, because every patient is different. There's like a fingerprint, right? But do you share that as well when you're doing packages and say these are expected costs? However, things could be different based on if you have some type of episodic event.
Everyone's different.
Okay.
So it's one of the things that we try to do is we're very transparent with our costs. So there's nothing hidden. Okay. But we do say to our clients, look, there's always a risk in everything we do. We're very honest. And so we'd say that there are risks involved. So give yourself some headroom in terms of, your financial buffer, just in, may not happen, but just in case, just give yourself a financial buffer. So we're very honest in that respect. The package, because they've had the virtual consultation with the consultant, and there's a really good idea of what treatment they need, we can tend to give them a good estimate, but then say, have that financial buffer just in case.
Okay.
And then, we make all the arrangements for them to come over. So we meet them at the airport. We arrange the accommodation based on what their needs are. It's also based on the type of operation they're having. If it's a cardiac surgery, we wouldn't put them in a hotel. It would be more of an apartment that's ground floor, that's easily accessible, that has a big enough bathroom for them. So there's certain things that we'd look at depending on the operation that they're having. So because it's very bespoke, it's tailor-made to that person, we tend to encourage them to bring someone with them, just for a bit of company and moral support. If they can't, that's fine. And then based on their age and their situation, if we think that they may need aftercare, we would say, you know, you perhaps want to think about aftercare, but what type of aftercare? It may be a registered nurse, or it may be a carer,
Okay.
in which case we would price that into the package as well so that they don't have to worry. Or we have a number of rehabilitation units that we work with that are absolutely beautiful, where they can get physiotherapy, nursing care, and 24-hour doctor care, if that's what they want and if that's what's needed.
Okay.
And then once they've had their procedure, we make sure that they get back to where they are safely, and we make sure that they have any follow-up that they need. So something like a wound check or a dressing check. And then we make sure that they have their follow-up appointment with the surgeon that's done the operation before they go home. Now, before they actually come over, one of the things that we always try to make sure that we understand is how long they need to stay in the UK broadly. And then we will base the package on that time period.
That makes sense. That makes sense. Your length of stay and all of the pieces that come into that. Okay. And then Shirley, would you say that that process is similar, or how would it differ for you if someone were in the US and looking to use your services?
Yes, it's exactly similar. The only difference I'll mention is it goes back to what you were saying around Latinas and Black women going over to Caribbean Isles to get surgeries and coming back and having complications. Um, I find that we may not be able to stop that, but to your point, we can do a better job of preparing them for what's to come, helping them to select better providers. Um, and then once they get there, ensuring that the accommodations that they stay in are sanitized and are thoughtful of, what the procedures that they are having. And then what I always tell people who are doing that is, I know they want to get back fast, but they still have recovery, even if they get back. And so I try to convince them to take a cruise. That's why my website is called Med Spa Cruise, because it's like, you're there, you get the surgeries. Let me get you a transport to the port. I can, get you onto the ship without you walking. There's usually a hospital or some medical facility on board the ship, and then you can take 3 to 7 days or longer to get back to Miami.
Oh, wow.
And it's a better experience. Uh, I haven't had any complaints. Most people are like, "Oh, thank you, for thinking of."
Yeah.
But yeah, so it's, there are many different ways to do this, and we can do it the hard way, or we could do it the best way, which is with support and the right accommodations to help the client get what they want.
I like that added piece of a cruise, because those who have been on a cruise know that everything is taken care of for you. So that's really
Yeah.
interesting that you have that. Before, I wanted to ask something, but I want to make sure I get to this question from SW537. It says, can you speak about the increase in ethnic medical tourism? Apparently, Turkey has become the new hotspot for people of color who want cosmetic surgery. Now, I would love to hear your perspective. I think I did a short on Turkey specifically because they are one of the only that I found that cater to African American textured hair for the hair transplants. And then others are going there predominantly for
Yeah.
dental work. And then
And
recently on
nasal.
TikTok, there was someone going for a full workup, and they didn't pay. I mean, it was a fraction of the cost of one imaging in the US. And this person had a full scan of issues that she's had over time. And that has made it more popular to go to Turkey. So if either of you can speak to that, I know that that's been the draw for many who have gone and who are interested in going. But I'd love to hear your perspective if you have one on Turkey in particular as it relates to this question.
Yeah, I mean, I believe that any country that is diligent in trying to meet the same standards as the US or UK or any developed country. Um, if as long as those standards are being met, the customers are going to have a good quality experience.
Mhm.
I'm happy to see people with textured hair, textured ethnic skin, finally get a leg up.
Mhm.
So it's nice to see Turkey, sort of coming up to speed. But I told Giselle this not too long ago. I went to Turkey several years ago before the pandemic. And Turkey is, I don't know if many people know this, but Turkey is across Europe and it also has an Asia side. So it's
Yeah.
like one of the countries that like is across all several continents. And so my husband and I went to the Asia side and we got off the little ferry and we were walking through the neighborhoods and all of a sudden throngs of people were behind us and they were following us and taking pictures and we were like, what's going on? And we went into a little pastry shop and I went down to the restroom and I heard them say, the Obamas are here.
Oh gosh.
So, I mean, things happen, but I mean, I'm talking throngs of people, like biblical throngs. So, at the time I thought, they've never seen people like me because they're, obviously enthralled. They're like taking pictures and, um, so, and my husband is a musician and he's played in Turkey for decades. So I have seen many different sides of Turkey, I'll put it that
Mhm.
way. And it's nice to hear that one or two facilities are doing a good job with one or two procedures. I think we need to be diligent about keeping it, being truthful and accurate around what's really going on there versus saying, oh my God, Turkey knows how to cater to Black people in their whole body. That's just not
Right.
the case. But having a consultant who can help you find the right uh, physician and get you there into some accommodations that work for you and get you back home safely, why not?
No, agreed. Because you all should check out the short that I did on Turkey, where someone on TikTok asked me about Turkey, and I shared that I wouldn't necessarily go for certain procedures to Turkey, as you alluded to, Shirley, because honestly, I know for a fact that the UK is been doing a lot of investigation of a number of deaths in the last few years. Specifically in Turkey, as it relates to weight loss surgeries, a lot of them were
Yeah.
sleeves or gastric bypass, and a number of UK citizens have lost their lives over that. So I know that there are specialties that they seem to be doing well in, and they do hone in and target that market. And again, it seems to be with hair transplants and with dental. I know that they
Yeah,
will say
Yeah.
they're doing everything and they're the best in everything, but you really must do your diligent research. And I think part of that is also working with someone like Giselle and Shirley, honestly, who know the landscape and can help you identify what would be the best option for you. Giselle, do you have anything to add to that?
absolutely. I'm really glad that you mentioned that, Natasha, because we've actually had a government advisory here in the UK as a result of those investigations that, um, that citizens should think twice before going to Turkey, that they're actually
Mhm.
putting their lives at risk. It's no disrespect to the country.
Right.
It's just that we have had um, a number of deaths, and not only that, it's what you mentioned earlier. The NHS, which is our National Health Service, which is our service that's free at the point of contact, um, um, they have had to pick up the pieces for all the people who didn't die but had
Complications.
serious complications, and then the taxpayer is having
Mhm.
to pay for that. And then there's a category of people who have serious complications. They may not come to the NHS, but they then have to pay out a lot more. So they have to keep going back to the same doctor, and that requires travel and hotel accommodation.
Wow.
So there's a slightly darker side of that
Mhm.
personally for me it scares me, because it's not just the fact that you don't know how well regulated those facilities are. They're very shiny. You've got all the shininess, but it's happening behind closed doors. And the way that those investigators conducted their investigation was that they walked the walk of a medical tourist. So they traveled there themselves, saying that they wanted a particular procedure, and then were met by all sorts of people, most of whom didn't have a good command of English and didn't explain things well, and then asked them to sign the consent form, not knowing what they were actually signing. So those things for me are really scary.
Right.
Because, if you're leaving, this is why I say, if you're leaving your country to go to another country, please heed this advice. Please understand what those risks are. Ask questions about what the mitigation is. What is the plan if something goes wrong? And make sure that you understand what the plan is. Make sure you understand what your recovery entails and what the risks are during that recovery time before you make the decision to get on the plane, because you're risking your life. And this is what happened with the people who, the UK citizens who went over to Turkey. A number of them have died, particularly with bariatric surgery, as you said. So it's a personal decision, but it's a big decision. So we can't underplay that. It's your health.
Not at all. I think outcomes is what we are all seeking, right? The optimal outcomes. And that leads me to ask about whether either of you in your work have partnerships with certified or accredited hospitals and clinics, and how do you go about verifying their quality and safety standards? I mean, are they accredited by international bodies such as the Joint Commission International or something along those lines? I would love to hear about that.
Let's give Madam Shirley.
Can you hear me okay?
Yes.
Yeah? Oh, okay, very good. My headset went out for a moment. Yeah, so I actually wrote down our algorithm. So our algorithm to select healthcare providers, we look at we have a weighting system, so it depends on the country, but we look at the country's healthcare laws, the regulations, the providers, the procedure availability, the peer reviews, the experience performing the procedure, to your earlier point, preferably minimally invasive. We look at patient feedback, proximity to medicines, recovery outcomes, as well as the accreditation by safety and quality bodies like the JCI, which is the Joint Commission International, and the ISO, International Standardization Organization.
And for, so in the UK, we have the healthcare here in the UK is very well regulated. And we have a health and social care regulator called the Care Quality Commission. And they do inspections, regular inspections of healthcare providers. And they have a rating system. So they're either inadequate, good, or outstanding. And the parameters that they use, the framework that's used, is based on patient safety. So they look at safety, they look at experience, and they look at efficiency and effectiveness. And that includes things like what's the infection control rate, the qualification of the people who manage the hospital, and their fitness to manage, the qualifications of the staff who perform procedures and whether they've been revalidated. So the consultants, they don't just qualify, they have to be revalidated every 3 years. And it's the same with the nurses. So we have to revalidate every 3 years.
Awesome.
And also whether they've had peer reviews, which is part of validation, whether they've had appraisals, what those appraisals showed, documentation, so risk management. So it's quite an extensive framework. And on those inspections and on that framework, they get graded. And so we would only use private hospitals and clinics that are either good or outstanding. Most of the ones that we use are the upper end of good or outstanding.
Oh, wow. No, that's excellent. It's interesting because earlier you had mentioned something about during the process, if someone wanted to seek your services, managing expectations. And I want to touch on that a bit. And I know we're almost at time, but I had to talk about it because I remember being interviewed and someone asked, what about if someone were going, say, maybe for an elective surgery? I'll go with one that's really popular, the Brazilian butt lifts. And they say, here's a picture. This is what I want. Now, if they have a frame that picture really would not be ideal to make them that busty or robust or whatever it may be, would a clinician just do the surgery because that is what the patient has asked for? Or would they say, this is really not the ideal situation for you? And I'm curious to hear how that's handled or if you've come across that, because sometimes people have some unrealistic expectations, specifically when we're talking about elective surgery. So I find that mostly.
Absolutely. So the surgeons in the UK, if they think that there's danger to life or potential harm, or that it's not suitable, they're very happy to say, they either say, I don't think this is the right thing for you. And if the client insists on it, they will say, well, you perhaps need to find another surgeon. And that's because they don't want to risk having a bad outcome.
Sure.
And they don't want to risk their reputation, because that's really important for surgeons in the UK. So they're quite happy to say, I'm sorry, but I'm not the right surgeon. If you're insisting that you have to do this is what I suggest. But if this is what you're insisting on, then you perhaps need to find another surgeon.
Oh, that's good to hear.
Yeah, I find that doctors will say that, but if a customer is persistent
Mm-hmm.
and they really want what they want, they will always find someone who can provide it. And
Yeah.
so I am of the frame of mind that, I need to help them find a safe provider. So what I typically recommend when I get someone that in my head, I'm thinking, ooh, 90 pounds and you want a butt like a heart, you know, I need to put you in contact with some people, physician who do butt lifts in Miami. And so I will bring them to, I have several facilities and hospitals that I work with there, and I have them do a virtual consultation, or if they're, willing to go in person, I will fly them there so that they can really have that conversation. In Miami, the equipment is so good that they actually can show that person like the before and after.
Mm.
And I think visually it helps people to go to sort of really see what they're asking for. Um, and typically we get to a point where, okay, we're not going to go with the holy grail out in the beginning. We're going to start with, some middle ground, and that's what we do. And then, if it's not enough, then we continue. But I also am very cautious of serial surgery
Yes.
clients. Um, yeah, because I do feel that it's not really a physical thing that they're working on when they do that.
Mental.
They're working on something that is deeper, more soul based, and they may need a wellness retreat or a life coach, or maybe a lot of clients I know have gone overseas for psychiatry,
Mm-hmm.
and that's more mental help. And so, maybe we retreat them there first and, just make sure that this change, this transformation in the body is really what they want. But, my advice is always baby steps
Mm-hmm.
to get what they want.
That's really interesting that you hear a lot going for psychiatry, because that has been something that's been asked about quite a bit, because the services are astronomical here in the States, even with insurance. You're finding that a lot of it is not covered. The co-pays are very expensive, and then you still have to pay out of pocket to see a psychiatrist or a psychologist. So that's why in the US, you'll find a number of online services that offer virtual visits that are for a certain fee that's nominal in comparison to what's out there. Those are widely used over even your insurance that is where it's supposed to be covered. So I think that's really interesting. I see a question from Nicole Henry. Thank you, sis. Hello, welcome. I may have missed this, but what are the roundabout costs for the services for the medical facilitators? I don't know if there's a general flat rate to even start working with you all, or how it may work, and it may work different in the UK than the US, but if whatever you can share, that would be great. And then we can round out the discussion, because I know that it is late and we're almost approaching an hour and a half, and Giselle is in the UK, guys. It is like after 1 a.m. At this point, and I know I'm keeping her. So I thank you so much for joining us and staying with us this long, Giselle.
Okay, that's okay. That's okay.
So, oh, go ahead.
No, please, Shirley. I'm really happy for you to go first.
I was just going to say that, I offer a 30-minute free consultation where we can talk about this a little more, because when I see a question like this, I have to answer a question with a question, like what procedures are we thinking about? What's the time frame? What's the budget? How do we know we're successful? Things like that are important before trying to offer a a price, or even a process, because I find, especially with elective surgeries, like people don't just jump into a tummy tuck. Like, there are a host of medical spa procedures that one can go through prior to getting to that point. We can do laser lipo, we can do bands around the waist, we can, it goes on and on. And so I find that if people really are cost conscious, that maybe we should start with med spa, and maybe they can get what they need in that regard, and before we jump into an actual procedure, especially one that's abroad. So I'm sorry to say, Nicole, but I think, reach out. Let's do a 30-minute consultation, and I can kind of wrap my head around what you're really asking. Once we know that this is what you want, and this is the medical tourism is the way to get it, then I typically charge a $200 planning fee with myself or people on my staff. And then depending on where you go and how you get there, I have a commission that comes to me through the travel companies. So there's typically not an additional fee after that.
Oh, that's excellent to know. And I mean, it does make sense depending on whatever you're going for and the length of time it would take and where you are deciding to go, what region of the world. Those costs also play a role in it. And Giselle, I would love to have you answer that.
Yeah, so we also do a free initial consultation for 20, 30 minutes. We do have packages for certain procedures, but we also, if you were to look on our website, you'll see that we have a bronze, silver, gold, and then a VIP package. So we have a basis of packages. So our bronze is kind of for people in the UK who they're already here and they just want support to find a consultant and do that initial bit. In terms of our international clients, if they're having a reasonably simple procedure, then our silver package is £3,995. That includes 5 nights of accommodation, and it includes, finding the consultant, your personal coordinator, who's your single point of contact. You get a mobile phone, and all the arrangements made for that simple procedure. If it's slightly more complex, then we have our gold package, which is £5,495, and that includes 7 nights accommodation, and it includes a couple of nights of aftercare. Those are the kind of main differences, and the transport is premium transport rather than standard transport. And then we've got the kind of platinum package, and that's designed with the person in mind, so it depends on what they want. So those are the kind of the basic, kind of pricing. That's the kind of basic pricing structure that we have. What you have to then add to that is the cost of the treatment, and then and then additional accommodation above the accommodation that's included. But then we also have packages. So, for instance, we have a hip replacement package, and I think we discussed this when we first had this discussion. So we work with a clinic that does hip surgery. It's minimally invasive, very quick. It actually takes 15 minutes. So there's less cutting. It's more focused. So there's no cutting of the muscle, no movement of the nerves. And so the patients that have this particular, and no drains, can you believe that, Natasha? No drains, because it's such a clean procedure that
that's unheard of in ortho, just so you guys know.
Right. And so those patients are up and walking within 3 hours, and then they get discharged the next day. So it's a very advanced and revolutionary approach to hip replacements, very minimal complication. So that package is it's around in US it's around 36,000 US.
Okay.
That includes 36, between 36 and 38, and that includes the surgery. It includes 4 weeks accommodation. It includes airport transfers. It includes your personal coordinator, mobile phone, and your aftercare. So it's a complete package.
Wow.
When you compare to the cost of hip replacement surgery in the US, that's 60 to 80,000 just for the surgery, not for all the other things. So, and we've got a cataract surgery package. We've got a prostate cancer treatment package. So
share the cardiac. You mentioned some differences in the cardiac pricing and procedure, which was amazing.
So again, on the minimally invasive theme, so in the US, cardiac surgery is about $200,000, and that's for standard kind of open heart surgery. And actually, it's more than that because of all the additional costs. But that's kind of the basic cost for cardiac surgery. Here in the UK, we have surgeons that do minimally invasive cardiac surgery. So that means you get a little cut, just a little cut. That's open heart surgery.
Amazing.
But we also have minimally invasive surgery that doesn't involve cutting of the breastbone. So they're going through the rib cage and they do the cardiac surgery. So again, it's less trauma, no cutting of the breastbone. So the recovery is very quick compared to open heart surgery. So the package cost for that is it's around 70,000 US, and that includes the accommodation, the surgery, the aftercare. If they're having the very minimal invasive surgery, which is going through the rib cage with no cutting of the breastbone, that's a little more expensive. That's more like 90 to 100,000, but it's still
a deal. My goodness.
50% cheaper than it is.
Yeah. And guys, just so you know, going through that area and avoiding a cut of the breastbone, less risk of infection. My goodness. Not only your downtime, but less risk of infection. So I mean, it's incredible. You have to think about your options. And again, I know we're at time. I just wanted to share that if you take away anything from this conversation today, I want you to know, one, you should do your research, your due diligence. But two, there are people out here that are able to do this for you for a minimal fee. If you are willing to pay a travel agent for a trip, how much more should you be thinking about something pertaining to your health? Your health is your wealth. And one thing that in talking with Shirley and Giselle prior to this live, one of the things Shirley shared with me was that she rarely has Black women as clients. And I think a lot of that stems from the fact that maybe people do not know that medical tourism facilitators and concierges, whatever term you use, they're not out there, and we're accustomed to doing all of the work on our own. Well, let me look into it. And the first place you typically go is, let me see what the insurance will cover. And usually they don't cover much, but
Not much.
Shirley is really well versed in the US insurance and what they may and may
Reversal.
not cover, and how you can tweak those things and see how you can have certain things covered under your particular insurance. Okay, so these are things that I really want you to take back and think about, and I want you to reach out to Shirley and Giselle to look into whatever type of treatment or services that you're interested in, to just know that you have options. I think it's important to know that you have options and that you can inquire about it, ask as many questions, and have someone with you to support you and advocate for you along the journey. Okay, and I placed both of their contact information, their websites, in the chat earlier, and I will make sure that it's in the description after this live is completed. Feel free to go on their website, fill out a thing for a consultation. It is free. It is free. It is free. Talk with them, ask your questions, and see what would work best for you. So I'm going to close out, and I want to just ask, I want to thank you both for joining us. And Giselle, thank you for staying up so late. But I want to close out and have you guys share your information again, and any last minute comments, because I'm sure you'll be asked to return as a guest of some sort, whether it's by myself or by my viewers. So Shirley, go ahead, and then Giselle, if you don't mind.
Okay, yeah. Well, I can't believe I went 90 minutes and did not mention travel insurance, because that is that's the way to win. You know, like if you are going overseas for any reason and you have an issue, whether it's on the table, because you didn't intend to have that heart attack on the table, or whether you're in an airport, travel insurance will help pay for all of that. It'll help with the crisis and a heartbeat. And so, whether you use me or not, make sure that you always get travel insurance. The other thing I like to say is, on my website, there's frequently asked questions called FAQ. Um, it has a lot of my answers to what we've discussed here. Feel free to go on the website and give me your email address and download it, and we can stay friends even after this.
Excellent. And then Giselle.
Yeah, I just want to really encourage people to prioritize their health, because once it's gone, it's not always easy to get it back. So if you are in pain, if you're suffering or in any discomfort, don't put off getting some sort of support to address that, because we none of us know, how long we have on this earth, etc. And actually we all want to live
Right.
life to the full, and you deserve to do that. And if I can help you to do that, I would love to be able to help you to do that. Our ethos is that we treat people the way we would want ourselves or our families to be treated, and we walk your journey with you. So you won't be alone in walking that journey back to good health. And we do physical health, mental health. We support with that as well, and we've got some fantastic health screening packages as well. So whatever your focus in terms of getting your health to be optimal, I can help you with it, and it would be an absolute pleasure to do so.
Oh,
Thank you.
thank you both so much. Authentic Life, before we go, says thank you all for your time and information tonight. So informative. Again, guys, please make sure you check out their websites. Take the opportunity to do the consultation and meet with them and ask as many questions as you need and see how they can help you. You need to have support if you make a decision to go abroad for any type of care. And these ladies are skilled and knowledgeable in that, so that you can have the best outcomes and experience on the journey. Okay. Thank you both for your time once again. And thank you all for watching. Leave comments in the leave any comments you have, any questions. We can possibly follow up and maybe even do another series if we need to. But that depends on you. Let us know what you think, and like, comment, subscribe, and share. Share with other women that you know would be interested and need to hear this information. Shirley and Giselle, please stay on. I'm going to end the live now, but thank you all. Have a great rest of your evening. Thank you.
Bye. Thank you for watching.
Thank
Thank
you.
you.